the most common vision problem in children is refractive error, myopia, hypermetropia, amblyopia, astigmatism. These are some of the most common vision problems in children. Then there are other relatively less common problems like congenital cataract, congenital glaucoma, ptosis, strabismus, squint, crossed eye. These are the common problems in children. There are some indirect signs by which parents or teachers can identify if the child is having some problem with his vision, like the child's academic performance is not very good in school. Like teachers sometimes complain, like if the child is sitting on front bench, he or she is answering the questions. If he or she is sitting on back bench, he or she is not concentrating. So many a times it is the class teacher or school which notices that something is wrong with the children's vision or eye. Then there are other things like the child takes more interest in indoor activities rather than outdoor activities. The child is introvert, watching TV from a very close distance. So these are some of the indirect measures by which parents can suspect if the child is having something wrong with his or her vision. Then there are some ocular signs like white reflux in eye, crossed eye, deviation of eye inwards or outwards. These are the things by which parents can identify, or anyone can identify if something is wrong with the child's eye. Ideally, first eye examination should be done at birth because there are some congenital eye issues like congenital cataract, congenital glaucoma, ptosis, congenital ptosis. These are the diseases which can present at birth, and if we'll not address them early, they can lead to problem with development, visual development of child. So the first examination should be done at birth, then the next examination at the age of 1 year. Both these examinations at birth and at 1 year are limited examinations. We cannot check everything in these examinations, but yes, definitely we can identify those serious diseases which can affect the visual development of child. Then a complete eye checkup should be done at preschool age, pre-nursery or preschool age, ideally at the age of 3 years, when the child is able to identify colors, when the child is able to identify letters. So we can do a proper eye examination at that age. Like refractive error being the most common. Myopia among refractive error is the most common problem. Myopia is basically a disease wherein light rays which enters the eye focuses before retina, and so the image of object is not formed on the retina. Hypermetropia is a disease wherein the image of object is formed behind the retina, so we use some specific lenses to let the image focus on retina. Then there is astigmatism. Amblyopia is a disease of eye wherein because of high refractive error, because of some other issues, the vision reduces significantly, and it is a reduction in vision without any organic problem of eye. So it is very necessary to address amblyopia as soon as possible because it can lead to permanent visual disability later life of the child. Chances of genetic diseases transmitting to children increases significantly if both the parents have the same genetic disease, or if there is history of consanguineous marriages, like marriages in family or relationships, then the chances of genetic disease increases. So it is important to identify family history of any such diseases before going for such kind of companionship or anything. Then second, appropriate diet is also has a significant role. Like nutritional deficiency, like vitamin A deficiency can lead to a lot of problems, corneal cirrhosis, corneal ulceration, which can lead to complete loss of vision or permanent loss of vision. The treatment basically depends on the type of problem we are dealing with. If it is refractive error, myopia, hypermetropia, astigmatism, or amblyopia, then the primary treatment is glasses. The child should be prescribed the glasses as soon as he or she is able to handle the glasses, which is ideally 2.5 years is the age when a child can handle with glasses. So for refractive error, glasses is the primary treatment. For small children, we don't prefer contact lens because they'll not be able to maintain the hygiene with contact lens. So glasses is the primary treatment. For amblyopia, if it is because of refractive error, the primary treatment is glasses, but we do one specific therapy which is called occlusion therapy, in which in this occlusion therapy we patch the good eye and we encourage the child to see from the weaker eye so that that eye can be strengthened. This is called occlusion therapy. Then for some kind of diseases like congenital cataract, congenital ptosis, congenital glaucoma, there are surgical treatments which are the primary mode of treatment. The first and foremost thing is the child should undergo regular eye examination. The first examination should be at birth, then at the age of 1 year, then at preschool age, that is at the age of around 3.5 years, and then after that, at least if the child is not having any refractive error, everything is fine, then the examination should be yearly up till the age of at least 8 to 10 years. And if the child is having refractive error, then ideally 6 monthly eye examination should be done, because the children are not able to identify if they are not seeing clearly with glasses, if their glass power has changed. So if a child is wearing glasses, regular examination at 6 monthly interval should be done, whether a child is complaining or not. Second, balanced diet is very important. Child should be encouraged to have a balanced diet. Third, the screen time should be minimized as much as possible. Maximum the screen time for a kid should be 1 hour, not more than that. That too on a bigger screen, television, not mobile phones, iPad, laptops. Then outdoor activities should be promoted. Like the child should be encouraged to go out and play rather than playing indoor or watching cartoons and everything. Any kind of sharp object or any kind of hazardous chemicals should be kept out of reach of children, because they can cause serious damage to eye. So these are some of the preventive measures. If we take these preventive measures, we can definitely prevent many kind of vision problems and eye injuries.